The news that your child has a congenital heart defect can leave you worried about their health now and in the future. Dr. Jeffrey Vergales is here to talk about that. And let's talk about how these defects can actually be diagnosed before birth.
Yeah, the vast majority of defects these days are actually diagnosed prenatally. So with the benefit of high-level cardiac ultrasounds, we have a very keen aptitude to be able to look at patients even well before they're born. Sometimes that can even be upwards of 12 to 14 weeks gestation. We can get an idea that there may be a congenital heart defect. But most birth defects involving the heart can actually be reliably diagnosed even as early as about 18 to 20 weeks gestation.
And what are some of the more common things you find?
Boy, it's very interesting. Unfortunately, prenatally, a lot of the stuff that we find is actually some of the more severe, although the most common heart defects that we deal with are not able to be diagnosed prenatally. These are such things like small holes between the pumping chambers, something that we call septal defects. These are basically, think of like a window between two rooms that allow blood to kind of pass back and forth in ways that it wasn't really meant to. That can go all the way upwards of defects where the vessels that come out of the heart were switched and are on the wrong side, or where valves did not form correctly, or even as much as something more severe where kids were only born with basically half of their heart. Those are some of the kind of range of defects that we deal with. While the most common are some of the more minor stuff, some of the more complex end up being the defects that involve a lot of requirements for a lot of surgery.
And obviously you hope things go smoothly every time, but it's inevitable you're going to run into complications from time to time.
Yeah, without a doubt. Now, the nice thing is that for the most part, a lot of the issues that we deal with children that have some of the more mild defects is that they're pretty normal kids, right? They have no real problems, playing on their t-ball team during the spring, or swimming, or even just out playing in the fall foliage or whatnot. But kids that have more complex disease oftentimes will have a lot more limitations, and sometimes can even be life-limiting. The thankful part is that even that is becoming much more of a rarity as we get better and better at managing even some of the more complex defects that we handle.
All right, and there are differences between how you treat someone, obviously prenatally and after birth. What's like one major difference?
Well, one of the big issues is how we counsel parents. Parents, as a general rule, because they have the information that is diagnosed prior, we can arrange for them to deliver at tertiary care centers where they otherwise are going to have access to high-level provider and high-level care. Some of our patients come from a whole variety of areas around the state of Virginia, around the Commonwealth of Virginia, and because of that, we oftentimes have to coordinate not letting a patient get sick as soon as they're born by coordinating their delivery when they're here. As kids that are diagnosed after, oftentimes if they're caught soon enough, or especially with new screening techniques that we have when babies are born, we have a very good ability to be able to manage babies that are going to require intervention as a newborn.
All right, Dr. Vergales, appreciate your time tonight. Thank you.